Hello and welcome back to our channel. I'm Dr. Kavipriya Soma here. Today we'll talk about something that has left a lasting impact not only on the general public but on the healthcare system and professionals. How did general practice change after COVID-19? The first thing that happened was changing of care from face-to-face to telehealth. So this has dawned a new era in healthcare wherein not only face-to-face but telehealth options opened up for patients' ongoing care. With lockdowns and limited face-to-face appointments and social distancing, telehealth was the way to go. And for the medical profession per se, going from face-to-face and shifting to telehealth, huge learning curve. Adapting to phone consultations and video consultations not only led us to improve our assessment, not just with body language, but with changes in the voice and the tone. Doctors offered consultations over the phone and prescriptions became electronic. Of course, there were challenges that came with those telehealth consultations. Like I said, we couldn't see the body language or see the patient's reaction, but we were still able to assess to a certain degree. Sometimes it was difficult to offer diagnosis over the phone because examination was not always possible, but still a good option for people who can't access face-to-face consultations or who are in a rural remote setting. Certainly, we can say that telehealth changed the face of health delivery system, and it's here to stay. Telehealth has become an important part of our ongoing healthcare, offering possible consultations like mentioned for rural remote, or short consultations like just getting the results, or simple things like just getting a prescription. What is the second impact that COVID-19 left us with? Changes in patient behavior. The two important patient behaviors that happened was increase in health anxiety and shifting the priorities for people. Due to the fear of COVID-19, people were delayed in seeking medical care for non-COVID related issues. This led to a decline in regular checks, preventive health visits, and routine screenings, which obviously have long-term implications for the health. Priorities shifted from preventive health care to more approaching and managing the immediate problems of facing the virus. Health anxiety skyrocketed during COVID-19. But as GP, did we actually do a good job? Drop a comment below. One of the positive aspects of the COVID-19 pandemic was rise in digital healthcare platforms. Advancements in healthcare technology not only led to telehealth consultation, but also streamlined online prescription of medications. In Australia, this also led to an increase in scope of practice for some of the pharmacists, to the advantage of the general public. What was the downside of the pandemic? Mental health support, not only for general public, but also for healthcare workers. Long working hours, dealing with personal protective equipment, and dealing with the virus itself led to significant stress and burnout in healthcare professionals, which identified the need for strong mental health support by debriefing sessions or peer group support, especially to the frontline workers. How do we build a resilient healthcare system? In Australia, we have a very good community healthcare in the form of general practitioner and a very good hospital system. Sometimes there's lack of communication, but to improve the overall health needs, primary care really needs good funding and investment. It also needs to embrace flexibility and adaptability to provide ongoing care for our public. Although we were one of the last countries to be affected by COVID, we did learn a valuable lesson. So from telehealth, digital prescriptions, that was a major advancement. Also, managing healthcare workers' psychological stress became a prime importance. So if you do like our video, share and subscribe, but also leave a comment as to what your thoughts are on what the pandemic did to us.